Hyperbaric Oxygen Therapy for Autism, Hope for Healing. Autism Spectrum Disorder, or ASD, is a complex condition that affects millions of children worldwide. It manifests through challenges in communication, social interaction, and behavior, leaving many parents and caregivers searching for effective therapies to improve their child's quality of life. One increasingly discussed option is hyperbaric oxygen therapy, often referred to as HBOT. Could HBOT be the breakthrough some parents have been waiting for? Or is it a treatment we need to approach with more caution? In this video, we'll explore HBOT's potential to address symptoms of autism. We'll dive into the science, hear from families about their experiences, and weigh the risks and benefits of this therapy to help you make an informed decision. Hyperbaric oxygen therapy is a medical treatment in which individuals breathe pure oxygen inside a pressurized chamber. The heightened pressure allows oxygen to dissolve into the blood and reach areas in the body where regular oxygen levels might not go. Originally, HBOT was developed for conditions like decompression sickness in scuba divers, carbon monoxide poisoning, and chronic wounds. It's also been used to treat traumatic brain injuries and strokes. The high oxygen environment is thought to encourage healing by boosting cellular regeneration and reducing inflammation. But why is HBOT being considered a potential treatment for autism spectrum disorder? The interest in HBOT for autism stems from evidence that children with ASD may experience systemic inflammation and reduced blood flow to the brain. Proponents of HBOT suggest that increasing oxygen delivery could support essential functions like brain activity, cellular repair, and neuroplasticity, the brain's ability to form new connections. HBOT is theorized to address some underlying physical conditions believed to exacerbate autism symptoms, such as oxidative stress and inflammation. Advocates claim this could result in better cognitive function, improved behavior regulation, and enhanced communication skills over time. While the theory sounds promising, separating fact from fiction requires a closer look at the science. Research into HBOT for autism is still in its infancy, with mixed results to date. Some studies suggest that HBOT could lead to tangible improvements in ASD symptoms, while others find limited or no effects. One specific study showed that children using HBOT exhibited better focus, improved language skills, and reduced irritability compared to a control group. However, the sample sizes in most clinical trials have been relatively small, and the methodologies are sometimes criticized for lacking robustness. It's also worth noting that some of the reported benefits might not directly result from HBOT itself, but could instead arise from placebo effects or other external factors like the structured environment surrounding treatments. Overall, while the limited evidence offers hope, it also underscores the importance of further research before declaring HBOT an effective treatment for autism on a larger scale. Beyond clinical studies, testimonials from parents and caregivers who have tried HBOT for their children provide an additional, albeit unscientific, perspective. Some parents report significant changes in their children after undergoing HBOT. Improvements such as better focus, increased use of language, and calmer behavior are often highlighted. For Jessica, a mother of a 5-year-old boy with autism, HBOT was described as transformative. She noted that after a few sessions, her son began making more eye contact and communicating with short sentences for the first time. However, not all stories are success stories. Other parents have undergone the therapy only to see little to no change in their child's symptoms. Melissa, a parent we spoke to, shared her disappointment that while HBOT was safe for her child, it did not result in the behavioral progress they had read about online. These differing experiences emphasize that HBOT may work for some children, but not for others, making it essential to approach it as a potential option, not a guaranteed solution. So, what do supporters of HBOT believe it can achieve for children with ASD? Let's break down the potential benefits. Cognitive and behavioral improvements. Some parents and doctors advocate that increased oxygenation helps areas of the brain linked to attention, language, and emotional regulation. Inflammation. Reduction. Many children with autism show signs of neuroinflammation. HBOT might help reduce inflammation, allowing the brain to function better. Emotional and social growth. Anecdotally, HBOT has been associated with enhanced social skills, such as initiating conversations or showing empathy through gestures and actions. While these benefits are exciting, it's crucial to remember that not every child experiences these results. Outcomes vary widely. No medical treatment is without risks or challenges, and HBOT is no exception. Before committing to any therapy, it's important to be aware of potential drawbacks. Physical side effects. Common temporary side effects include ear pain or popping due to changes in pressure inside the chamber. In rare cases, oxygen toxicity or lung complications could occur. High cost. HBOT is an expensive therapy. Sessions can range from $100 to $250 per session, with many children requiring a series of 20 to 40 treatments for noticeable results. For most families, this represents a significant financial investment. Accessibility. Not every community offers HBOT facilities. For some families, accessing treatment requires significant travel or relocating temporarily, adding more strain to their lives. Lack of guaranteed results. Lastly, while HBOT has shown positive results in small pockets, it's not a universally effective solution. Parents must balance their hope against realistic expectations. For parents seeking treatment options for their child, it's only natural to feel hopeful when hearing about cutting-edge therapies like HBOT. However, it's important to approach these options with a healthy level of caution. Experts are quick to note that HBOT is not a cure for autism. ASD is a complex condition, impacted by a wide range of genetic, neurological, and environmental factors. While HBOT may improve certain symptoms for some children, it is unlikely to address all of the unique challenges that come with autism. Parents are encouraged to view HBOT as one part of a broader treatment plan, rather than relying on it as a standalone solution. Keeping expectations realistic can prevent unnecessary disappointment and financial strain. How does HBOT measure up against other autism therapies like applied behavior analysis, ABA, occupational therapy, or speech therapy? The key difference lies in HBOT being a biomedical intervention, whereas most other therapies focus on skill building, communication, and behavior management. While traditional therapies have years, even decades of evidence backing their efficacy, HBOT remains experimental when it comes to autism. Some experts suggest that HBOT might be most beneficial when combined with these more established treatments. For instance, improved focus and learning capacities following HBOT could enhance a child's ability to engage in speech or behavioral therapies. What do medical professionals and researchers think about HBOT for autism? The opinions are mixed. Some doctors and therapists remain optimistic, citing promising studies and positive anecdotes as reasons for cautious enthusiasm. Others, however, are skeptical, emphasizing the lack of large-scale clinical trials proving HBOT's effectiveness beyond placebo results. Professional organizations, such as the American Academy of Pediatrics, have yet to officially endorse HBOT for ASD due to insufficient evidence. As a result, some healthcare providers may hesitate to recommend HBOT until more research validates its use. If you're a parent considering HBOT for your child, here are some important factors to think about. Consult your doctor. Begin by discussing HBOT with your child's healthcare team. Ensure your child is medically fit for the therapy. Evaluate the clinic. Look for reputable HBOT centers that are certified and have experience with children. Ask questions. How many sessions will your child require? What costs are involved? What outcomes should you expect? Assess impact on lifestyle. Consider the impact on your family's routine, finances, and overall stress levels. Stay informed. Keep researching HBOT and stay updated on new studies that could influence your decision. Hyperbaric Oxygen Therapy represents an intriguing option in the ever-expanding field of autism treatments. Its ability to increase oxygen levels in the brain has sparked both interest and debate among researchers, parents, and advocates. For some families, HBOT has shown incredible promise, resulting in noticeable improvements in focus, language, and social interaction. For others, it has produced little to no effect, highlighting its varied outcomes and experimental nature. At its core, the decision to pursue HBOT should be shaped by a combination of scientific evidence, expert guidance, and personal circumstances. Above all, parents must balance their hopes with a realistic understanding of what the treatment can and cannot achieve. If you're interested in exploring HBOT as a therapy for your child, start by consulting with a trusted healthcare provider. Ask questions, conduct thorough research, and learn as much as you can about the therapy. Remember, autism is a highly individualized condition, and what works for one child may not work for another. But equipped with knowledge, compassion, and a willingness to explore all options, you're already playing a significant role in supporting your child's journey. Finally, don't forget to check out additional resources linked below for more information on autism treatments and support groups. Thank you for watching, and we hope this video has provided clarity and insight into the potential of HBOT for autism.